And we recognize that individuals with brain injury, it's not just like a broken leg that you can see and that's defined and that has a healing pattern. It's very individualized and personalized. And in order to help our patients, we actually had to learn a lot about, like, how do you live life with a brain injury and how do you navigate?
There is always hope, and you are not alone.
Welcome to Hope Survives, a podcast from the Hope Survives nonprofit supporting individuals and families navigating life with brain injury. I'm your host, Cristabelle Braden. After my own experience with traumatic brain injury, including multiple re-injuries, I've learned how isolating this road can feel and how hard it can be to find a way forward. No one should have to walk it alone. On this show, we explore the realities of life with brain injury through encouragement, thoughtful conversations, expert insights, and real stories. No matter where you are on your journey, remember, you're never alone, and hope survives.
With a little hope, you can make it through today. With a little faith, someday you'll get through the pain. Just a little love is enough to light the way through your darkest night. Hope survives. A little faith and a little love. Hope survives. A little faith and a little love. Hope survives.
Hey friends, welcome back to Hope Survives podcast. Today is a super important conversation that I am so excited to have on mental health and brain injury. This is a much needed but often overlooked topic because the focus tends to be on the cognitive challenges or on the physical challenges or on a lot of the other things, and emotional health sometimes falls by the wayside. And this is hugely important to us at Hope Survives, that we are here to help meet that gap, right? And we have an incredible guest today that has the similar passion for meeting that critical gap. And she is the perfect person to have this conversation with today. I am so excited to introduce to you Dr. Edie Zusman. Dr. Zusman is a nationally respected trauma neurosurgeon. Yes, you heard that right. We have a neurosurgeon talking about mental health because she's that amazing. A nationally respected trauma neurosurgeon known for her clinical research on brain injury resulting from domestic or intimate partner violence, child abuse, or assault or trafficking. She has made groundbreaking progress in research in these areas that are often overlooked. Dr. Zusman started at Northwestern University Medical School at the age of 19. She did general surgery internship and neurosurgery residency at the UC Davis Level 1 Trauma Center in Sacramento, California. She also has served as the chief of neurosurgery at the Mayo Clinic Network-affiliated North Bay in Solano County, where she led the TBI and Concussion Clinic, and is currently Director of the Neuroscience Partners, leading an interdisciplinary care team for TBI and concussion from all causes. She's also an adjunct full professor. Dr. Zusman has been invited to present her research findings on brain injury at Stanford University, Northwestern University Neuroscience, UC Davis Law School, the World Federation of Neurological Surgeons, and the World Health Organization meeting in Cape Town, South Africa, and the North American Brain Injury Society. She currently serves on the board of directors for the Family Violence Appellate Project in California. And Dr. Zusman is CEO and executive director of Safe Living Space, a 501c3 nonprofit and educational philanthropy to address the incredible gap in brain injury evaluation and care. Dr. Zusman is an incredibly inspiring and phenomenal individual, and you will be blessed by what she has to share today. Some of these topics are a little bit harder to talk about and a little bit harder to listen to, But we're so glad that you are here, and we want you to know that no matter what you have gone through on your own journey or what brought you here today, there's hope and you're not alone. Those are our taglines at Hope Survives for a reason. And Dr. Zusman is very aligned with our vision here at Hope Survives. So we're very excited to introduce you to her. We're going to be talking about understanding both the need for neurological and psychological support and understanding cognitive and emotional challenges faced by individuals with brain injury. But we know brain injury doesn't just affect the person with the injury, it also affects the entire family. So you can stay connected at hopesurvives.org to learn more about our programs, to get connected, and you are not alone. So before we get into today's interview, we would like to thank our sponsor. The Functional Neurology Center offers personalized neuro recovery programs for anyone going through brain injury and a wide range of neurological conditions. When you trust your brain to the team at the Functional Neurology Center, they take the time to get to know the whole you so they can personalize your recovery program for your unique and complex condition. There's hope for a better tomorrow, and the FNC is committed to helping you get back what matters most. Visit thefnc.com for more. And thank you to the FNC for your support of the brain injury community and us here at Hope Survives. So without any further ado, I would love to take you right into this conversation with Dr. Zusman, and let's talk about it. If anything comes up for you as you're listening, please email us hi@hopesurvives.org. We are here to be a resource for you, and you're not alone. I am here today with Dr. Edie Zusman, and we are so excited to welcome you to Hope Survives podcast. Thank you for taking the time to speak today and to share your expertise with our listeners.
Well, I'm a listener as well, and I think your podcast is just so important. There are a lot of gaps in what people know about the brain injury they have.
Thank you so much. I really appreciate that. And as far as those gaps go, I mean, we're going to be talking about a little bit of that today. But before we get into that, can you introduce yourself and some of your background in brain injury and neurosurgery?
Yeah, as a little kid, I was always interested in the brain and how it worked and where new ideas came from. And I was lucky to be accepted to medical school when I was 19 at Northwestern, and then did my neurosurgery training at UC Davis and special fellowship training at UC San Francisco. So I am a trauma trained neurosurgeon. I was chief of the Mayo Clinic Network affiliate in Northern California. And during COVID, we started seeing a lot more traumatic brain injuries. There was interpersonal violence, and there was a lot more accidents. And it was just a really important time for me to understand that brain injuries affect two sides of the brain. It affects both what we think of as the cognitive, the thinking part of the brain, but also the feeling and the personality part of the brain. And sometimes that's labeled as the mental health side of the brain.
Yeah. And so your experience, can you speak to some of your experience working with brain injury, as well as how you got started safe living space?
Oh, well, thank you for the question. So one of the things that was really clear when we were taking care of patients with brain injuries from all different causes was that people would forget their appointments, or it would be very difficult for them to complete the paperwork, or they weren't able to figure out, what time the ride needed to pick them up in order to bring them for the appointment. And that was when it got real for us. And we recognized that individuals with brain injury, it's not just like a broken leg that you can see and that's defined and that has a healing pattern. It's very individualized and personalized. And in order to help our patients, we actually had to learn a lot about, like, how do you live life with a brain injury and how do you navigate? So I think that was really the first awareness that we as medical experts needed to do more, and we needed to learn more. And that brought us to Safe Living Space, where we realized that, here we were as experts worrying about the gaps in the care that we were providing, and what was it that we needed to understand and learn about high-risk populations like, homeless and substance use and domestic violence. in addition to what we all think of like sports. And so we went ahead and started an educational organization that does clinical research and public health education. And it's called Safe Living Space because we want everyone to have brain awareness where they live, work, and play.
And I love what you're doing there and so grateful to be connected with you. So, when we talk about some of those gaps with brain injury, that's really what the heart of Hope Survives was born out of, understanding that there's so much more than just the medical side of brain injury. A lot of people are sent home after their rehab therapies or whatever, and then they're thrust into the real life and realizing that a lot of people struggle with their mental health, with their emotional side, spiritual side. There's so many facets and components to being human. And so much of that can be affected by brain injury. So, where do you see those gaps? And let's just start there.
Well, Cristabelle, I just want to say that was so beautifully stated. That really frames the question directly. And, as a neurosurgeon, we think that patients are doing great if they know their name and they can tell us the date and they can hold their arms up and they can walk without, holding on or losing their balance. And that's good for neurosurgical screening to say whether somebody's safe to go home or not. But I think there's a really big kind of drop off with what are the specific cognitive changes, the thinking changes, the memory changes, do they understand a joke in the same way? Can they multitask? Do they get fatigued? Are they only kind of themselves maybe a couple hours a day? And the piece that I've been working on so hard now, including retraining as a somatic experience practitioner, so I can actually understand and work with the mental health elements. I think that's really where the opportunities are for us today.
Wow. So, you're training in somatic. Tell me more about that.
So it's a form of trauma counseling that helps individuals with how they store memories and how they recall memories. It's very much the opposite of neurosurgery. It's all about what you feel in the body. And I found that when I was taking care of my brain injured patients that I thought I was doing a great job because I knew their brain injury. And they'd be like, Doc, but what about all this other stuff? And I'd be like, well, so I really just saw that as something that I couldn't give to my patients. And it was something that I personally wanted to learn. So I went on that journey and just feel like understanding and being able to work with the mental health elements, it really puts the pieces together.
That's so beautiful. I've never heard of another neurosurgeon caring so much about mental health. I mean, that's so beautiful that you could have both things be so kind of like opposite ends of the spectrum of caring for the brain, but yet everything's integrated, right? There's nothing in your brain is in silo.
It's all one person, it's one human being, and they have both elements. And I do think that is why Safe Living Space and the clinical research we've been doing has just been, really impactful and really transformative, getting these messages out there. I think one of the things that people don't even realize about brain injury, we always think, oh, if you hit your head or your head hit into something, but you can get a brain injury from a stretch between the head and the neck. And we call it occipitocervical stretch between the head and the neck, where you can have long-standing neurologic changes that can be missed. It goes under the radar. And the other way that individuals get brain injuries that also aren't clearly identified is from different types of chokeholds that we're seeing. Sometimes right now the kids are doing it at school. It's part of training for military and first responders, or has been. And then it can be seen in different types of interpersonal violence, super important, strangulation and chokeholds, to be thinking about brain injury there. So if you've got a brain injury and you don't know it because it's one of those other mechanisms, or you thought, oh, I was playing sports, I just got my bell rung. Cristabelle, I think a lot of those folks develop what have been labeled mental health symptoms. And they'll go to a mental health provider saying, I feel more anxious, or ever since the car accident, I've been afraid to drive, or they're coming back from the military and they'll talk about PTSD. And I think that we've got to start understanding more about the brain injury as being part of where those symptoms come from.
I love that you said that, because I've talked before on the podcast, we've mentioned before that a lot of times neurological things get misdiagnosed as psychological. And I've had so many people join our support group and say, hey, like, I had a fall when I was a kid, and then my whole life I struggled with mental health issues, and it wasn't until recently that I found out it was probably a brain injury. And
Yes.
there's so many things that cannot be treated psychologically if it's neurological. If you are, one example is I had undiagnosed dysautonomia for many years. And I had a neuropsychologist having me in biofeedback therapy because of my anxiety. My heart rate going high was not only mental health anxiety, it was a physical autonomic response that I needed another type of therapy for. And for so long, I kept thinking, what is wrong with me? Why do I feel so anxious and on edge all the time? I can't exercise. I feel like I'm going to pass out. Like, I just feel so overwhelmed constantly. And I thought it was anxiety, and that was being reinforced by a neuropsychologist that I was seeing. It wasn't until a couple of years later that I finally got my dysautonomia diagnosis and the pieces clicked.
Oh my gosh, that opens the door to an incredible lane of discussion. One of the things we see after a car accident is, and so this would be, let's say, an example where somebody was wearing a seatbelt and they got hit from behind at a reasonable speed, and their mechanism of injuries was called a whiplash, where their head goes first backwards and then forwards. And we'll get individuals who come into our clinic 3 months later, 6 months later, saying, oh my gosh, doc, I've been trying so hard to get back in the car and get back to driving, and I've done my breathing and I've done all kinds of different counseling for it, but I just turn white knuckle by the time I get to work 20 minutes away. And I'd say, well, tell me more about that. And they'd say, well, I see cars coming into my lane. I can't judge the distances. And it makes me really afraid. And so I'll do a neurologic exam, just like you're talking about with the dysautonomia. I'll get the data, and sure enough, these individuals have abnormal near point convergence. And it's super simple. I'll just show you that if you put your finger up, at some point you should see one. And then as you bring it toward your nose, it splits for everybody, but it should split really close to your face. And these folks were seeing double at like a foot, at 2 feet. And so essentially what they were doing all their trauma counseling for, exactly like your story, was because they had what they thought was anxiety for driving because they saw cars coming into their lane. Cristabelle, guess what? They saw cars coming into their lane because from the brain injury, their eyes were no longer aligned to give them the information they needed for depth perception. And when these folks get their, glasses on or do their neurooptometry therapy, and some of that gets addressed, all of a sudden, it's in some circumstances, it's really not anxiety for driving. It's a true neurologic symptom that's been characterized. And I think in this situation, it's important that we give voice to both and we give space to both, that it's possible for both to exist. It's possible to have anxiety, and it's also possible to have dysautonomia that looks like anxiety, or something I'd love to hear your thoughts about. It's called loss of selective attention. And I'm wondering if that was something that you had also experienced.
I'm unfamiliar with that term. Can you explain what that means?
Sure. It's a scenario that all of us have been in, where you're like in a cocktail party, crowded room, you're in a bar at a football game, or you're trying to have dinner in a loud restaurant, and and most individuals, or let's just say prior to a brain injury, they're able to kind of tune out the background noise. They're able to say, oh, I hear some music, but I want to talk to Cristabelle. I want to talk to the person opposite me, and I can tune out all the other things happening, the conversations behind me, the people walking by. If you have a brain injury and it happens to have lost your ability to block out that background information, loss of selective attention is the medical condition that we would diagnose. You can walk into a room for Thanksgiving with your family and friends. If that room is loud and a lot of people are passing things and the kids are playing and there's light coming down,
Mm-hmm.
you'll have 15 minutes and then you'll be like, I love you, but I've got to step away for a little bit. And that's not anxiety. That's loss of selective attention. That's what all of my TBI patients have, where they can't drown out the background noise and it all just comes in with equal weighting. Um, any
Oh,
thoughts?
yes. I just called that not having, I would always say, I have no filter going out or coming in, meaning that I'm unable to differentiate between everything around me. And I would call it, I guess, overstimulation or sensory um, issues, I
Sensory
suppose.
overload.
Yeah, sensory overload.
I love that. I love that. And to me, I think that really affects interpersonal relationships
Hmm.
and some of our highest performing individuals, like our operators from the military, who were, leaders of their groups. They turn it against themselves. They're like, "Well, I'm not the same person I used to be." Or a spouse will say, "Well, I don't know. She always wants to stay home. She doesn't like to go out anymore." Or she can't even go to the grocery store and come back without it being a big to do. And once you understand that that is an absolute recurring finding for an individual's neurologic condition, all of a sudden you're like, okay, I get it. So I can go to the grocery store, but I should go before it gets busy. I should go in the morning, or I want to spend time with my friends, but it's not going to work if we're at the old bar that we used to go to. Let me meet them, in a park, and maybe we'll go for a walk and talk so I can focus on what they have to say to me.
Yeah, I love how you're pointing out how these brain injury symptoms and these things that are common experiences can affect your relationships. It can affect everything around you. And a lot of times that does get missed. And the person is left feeling like, what is wrong with me? Why can't I just feel normal? I mean, I remember feeling so frustrated that I just wanted to be normal. And the other thing is that it's not the same every day. I might be able to go to a restaurant and have a great conversation and feel like, wow, I didn't even have to put in my earplugs. And then the next day, I pushed it too hard the day before. And the next day, I'm unable to replicate it. So then it feels overwhelming. And there's so much of like, for my journey has been having to learn how to listen to my body and my brain and continually give myself that grace, right? But it's so hard when you're just in that sea of not knowing and not being able to figure it out.
And I feel like that's where my training comes in, because I can help people understand the neurologic condition and give them the tools and truly empower them to take control of a situation. So, for example, I have a housing contractor who used to really pride himself on being able to listen to somebody's list of what they needed in their special, high end homes. And now he can't remember by the end of the conversation what were the things. And so, maybe one of the things that this individual can do is bring a clipboard and his pen and say, Mrs. So and so, I want to hear every idea you have. I'm going to write each one down, and then afterwards I'm going to go over them with you, and you tell me which are the most important to you. And so there he was able to convert a neurologic condition, which was decreased short-term memory and decreased auditory processing, into an asset where his clients say, boy, I love my contractor. He writes down everything I say. He wants to make sure he got it all. And he even asks me which of these are most important. So those are the types of skill building that individuals with traumatic brain injury can do once they understand the neurologic elements.
So, what are some of those neurologic elements that you think people should look out for to identify?
Well, we talked about selective attention. You talked about beautifully dysautonomia, which is a classic part of particularly the occipital-cervical stretch. The whiplash mechanism is really highly associated with the dysautonomia. I want to share one that I think may be true to your story as well. And I'd love, again, the back and forth, the like first person feedback. And it's called cognitive reserve. And essentially, all of us have some level of cognitive reserve. And, for me as a neurosurgeon, it would be very possible for me to be working 16 hours, full go. Before I reached a point where I'd be like, oh gosh, okay, I'm going to go get something to eat. I need a few minutes. If you've had a traumatic brain injury, you may have moments of the day where you just say like, oh, I feel like myself today. This is so nice. I feel like myself. And it may be that you feel like yourself and can perform at that higher level an hour or two a day. And it may be that you can perform at that high level that feels so familiar to you, maybe between 10 and 11 in the morning. And so what I encourage my patients to do is really think about, like you said, listen to your body, see when is your best time of the day, how long does it last? And when I'm working with couples, what I hear a lot is, well, it happens to be gendered in this story, but it's like he's great at the office. He does all the things he needs to. When he comes home, he's totally spent. He doesn't even want to talk to me at dinner. He wants to spend time by himself. He doesn't want to go out, totally spent. And they take it personally. They say, well, he's cares about his work or his daytime activity, but just doesn't care about me enough to give me the energy. But it's simply a neurologic issue of cognitive reserve. And so what we do in that case is we say, okay, if you've got an important event, if it's a partner or a spouse, and you know that your loved one doesn't have the cognitive reserve, doesn't have anything left at the end of an 8-hour workday, then that's a day that they might need to take off. So if you've got an evening dinner and you need them to be there and be present for something that will take a lot of cognitive ability, you might need to take the day off so that you haven't used up the 1 or 2 good hours. And absolutely, you need to take the next day off because it's going to take about a day to recover from something that requires all of that multitasking, right? Interpersonal connection, remembering what they said, auditory processing, following the dialogue. If you've got all of that and you're dealing with all of that as a brain injury, you just want to protect your brain and give it the chance to be successful by not overtaxing before or after that type of an event.
Yeah, that's so good. I definitely experienced that. I would call it my battery level. Brain battery runs out.
Perfect. I'm gonna start using medication. And just say, do you ever feel like your battery runs out? And how long does the battery stay, good? And
Yeah.
what times of the day does it work best? But even for work, and again, we can truth check this with someone who knows as much as you do about this. If I've got a patient who's used to having back-to-back meetings, that is not successful. But if they leave 15 minutes between meetings where they can kind of summarize the first meeting, pause, start thinking about the next meeting and plan ahead, they can do the meetings. They just need gaps between them. Whereas before they might have been able to just, tumble through and go from one to the next. How does that sound to you? Is there
That's very accurate to me. Yes, I definitely have been learning where my cognitive energy is best during the day. And especially with Founding Hope Survives and all the meetings that we have and the screen time and the virtual meetings and podcast recordings and all these things, I've had to learn what kind of gaps I need in between, as well as what times of day works better for me. And it's interesting because what worked well for me a couple years ago was first thing in the morning, but that is no longer the case. Now I'm not good until the middle of the day, and then I taper off towards the evening. And so I've learned that it takes me a little bit longer to get where I can really feel focused and tuned in and there, but it is limited and it depends how much I've slept. And I recently learned the power of a nap. I never used to take naps because I couldn't fall asleep because of my brain injury. I was on medication to fall asleep. And I've been working with a holistic practitioner on some supplements and doing my labs and figuring out like what's going on metabolically. And I was able to get off my medication and replace it with a supplement. And then slowly I've been able to fall asleep without medication. And it's in the last couple months, I learned how to take a nap for the first time ever since my injury. And it makes a big difference. Even something short, I've learned I can stretch my cognitive energy for a day if I can lay down for an hour in the middle of the day.
Brilliant. That was just so beautifully stated and well spoken. And I think that goes right along with some of the things that I've seen individuals do. Like they'll say that they always get out of the office at lunch and they kind of walk somewhere very quiet, very peaceful, and then they're able to come back and get back in. So I think what you said at the beginning about really listening to your body and finding kind of the new normal. It's why this podcast is so important to me and to the folks I care for.
Thank you. And I think what has been so surprising for me is that it does change season to season, that it's not going to look the same for me as it did last year. There's setbacks, there's flare-ups, there's different things that affect you. In some areas, you might actually find that you've healed and you don't need as much as you used to. And so also being flexible with yourself with even the tools and coping strategies that you have.
Mm-hmm. Yeah, beautiful. One of the things that comes to mind is how important it is to check hormones if you're having different interactions with the people you love in your life, and your your sexual performance or sexual energy is different after a type of trauma, particularly if it was a physical trauma. And that can be something that's literally like addressed immediately. There can be low levels of hormones that require replacement, like thyroid if you have low energy. So I do encourage anyone who's still having symptoms after about 3 months, for sure. Usually after 6 weeks, they should be questioning, where do I need to go for the next level of care? But certainly by 3 months, they need to have a really good, very comprehensive assessment. Sleep, to me, has moved into number one. I will do like memory testing and cognitive testing with an individual when they first come into our practice, and then later on. And the single biggest impact on both depression scores, anxiety scores, and cognitive is getting a good night's sleep. So I would love to explore that with you more and hear what we can share with others that you've learned.
Yeah, there's so much that we can go into. And you're just a wealth of knowledge and information. And I just love your compassion and the way that you approach everything. And I love that you said sleep moved into number one for you. I think that was so unaddressed for me for so long. The doctors just thought, well, she's on this medicine and it's making her fall asleep, so that's not a big deal. But I was looking at it, I'm like, I was on the same medication for 14 years and they never thought to address it. I took myself off of it by talking to my doctor. I'm like, I don't want to be on this anymore. How can I change this? I didn't do it on myself. Like I didn't do it without medical guidance, but I was the one who had to advocate and bring it up because they'll just prescribe medications and keep you on them forever. And so I had to address that and figure out, how can this be affected? But we talked a little bit about like the gaps and how there are so many neurological things that can happen that can be addressed with mental health, but a lot of times it is a combination. There can be mental health struggles and the neurological struggles, and it's just a big combination. And so we could talk so much longer, but we do need to wrap it up for this podcast episode. And I'd love to ask, are there any final things that you just want to share about any of those gaps or any of the things we've talked about that you'd like to share before we close?
Yeah, I think my takeaway message is self-advocacy, that brain injuries can cause all kinds of different symptoms. It can slow down your thinking, and you might interpret that as depression. We talked about how it can present as anxiety if you're in a room with too much stimuli and not enough incoming filter working. It can present as even panic attacks or suicidality for individuals who say, look, I'm trying all these things and I'm just not getting better. And so for me, the takeaway from our time together is be your own advocate. Understand that we're all on a journey to learn. And if the person you're working with isn't able to kind of give you more insight into what's going on, then ask the questions of another provider that don't I almost want to say, like, don't take no for an answer. Just keep pursuing your truth. And if that requires learning from others or stepping out for yourself, I would just encourage each person who's experienced traumatic brain injury to do just that.
I love that advice. Thank you so much. We always close by asking our podcast guests, what is your final words of hope for our listeners?
Words of hope. Brain injuries get better. Brain injuries heal 4 different ways. The first way is by preventing the next brain injury. And this is particularly true for people who have repeated brain injuries, for example, from domestic or intimate partner violence, that if you get one brain injury, you want to try to prevent, just like we do for football. And I think that the second way the brain heals is just time. And that the third way is by training to develop collateral pathways that can work. And the fourth is so important. It's strategies. It's, using your phone to set your timer if you've got to pick up your kids from school. And you may even have to set it twice. Once, 30 minutes to get ready to pick them up, and once 5 minutes to leave the house. So I think, to me, that's the most important thing about brain injuries is the world's different now, and brain injuries heal.
That is such good advice. I love it, and I love the practical tips. Thank you so much for your time and for sharing your expertise with our audience. I would love to talk with you more and have you back. And if anybody's listening and they're like, wow, I have some questions for Dr. Zusman, email us hi@hopesurvives.org, and we would be happy to pass anything along. If anything in this episode sparked a thought for you, our email inbox virtual door is always open. So thank you so much for being here, and thanks everyone for listening.
If you enjoyed today's podcast, we would love if you would consider leaving us a rating or a review. We are so grateful to be able to provide this support for the brain injury community. And if you would like to get connected, please visit hopesurvives.org.